Welcome, everyone, to the Turn Your Practice into a Regenerative Powerhouse webinar sponsored by OMNIWave. Before we get started, I would like to share that any questions will be addressed at the end of the webinar. If you have questions, please use the Q&A icon located in the Zoom toolbar. Today's webinar will be recorded and available on the A4M website for your convenience. Now let me turn it on over to Nicole Bach from OMNIWave to start with our presentation. Welcome and thank you so much for being with us.
Thank you so much, Ashley. We're going to be waiting, let's say a minute just to have a couple more people join us, but thank you everyone. My name is Nicole Bach. I'm the VP of Marketing of OMNIWave, and I'll be your moderator for today on this webinar session. And we're going to talk about how to transform your practice into a regenerative powerhouse. So exciting topic here. And I'll be joined by our Dr. Jason Dunlap. We'll go for presentations in a little bit. Just wanting to wait one more minute to see if everyone is joining. Okay, I would say let's give it a start. Again, I'll quickly introduce myself again for the people that just joined. My name is Nicole Bach. I'm the VP of Marketing of OMNIWave, and I'll be your moderator today. I'm joined by our special guest, Dr. Jason Dunlap. He will be telling you everything about how to transform your practice into this regenerative powerhouse through the use of shockwave. And I would say let's kick it off. Let's go through our agenda today. I'll obviously have Jason introduce himself a little more, tell you about his background. Then we're going to ask a couple questions and really see, okay, what are we going to be answering today during this webinar? We're going to look into what is shockwave. A lot of people have heard of shockwave, but ultimately don't really know the differences between different types of shockwaves. And there's many of those, as we will see. And then we'll have Jason talk about his story and how his practice is very successful, actually two practices, very successful practices, and how OMNIWave and shockwave in general has helped him transform his practice. And then we'll just have our Q&A session where you can ask your questions. And from there, we can hopefully connect more into a call potentially. So I'll kick it off and have Jason introduce himself. Tell us a little bit about yourself, your background, and just your practices.
Hello, everyone. I'm Dr. Jason Dunlap. I currently live in Ormond Beach, Florida. My practices are also in Ormond Beach, Florida. I am a chiropractor. Before I was a chiropractor, I was a high school football coach, track coach, weightlifting coach, worked with a great deal of athletes, kind of transitioned me into working with musculoskeletal injuries. My kids were always down and out, so making the transition to a chiropractor was fairly easy for me. I went to Palmer College of Chiropractic here in Port Orange, which is about 20 minutes south of me. And that is where I first learned about shockwave. And it was taught actually in my program how to use it. And then we actually got to use it a lot when we were in clinic. And I was able to treat a lot of patients, including myself.
Amazing. So what we're going to be looking into today, and we're going to try to answer, are these kind of 4 questions. I'm going to read them out loud because shockwave is truly that tool that can help you move your practice and transform your practice. And again, Jason, you'll be telling us all about that. So if you're here and you want to enter the regenerative space, but you don't know how, this is one of the ways. You want to maximize your revenue and have multiple treatment options. Again, shockwave is a tool that can bring you there. Are you looking for something that is cost effective and can give you immediate ROI? We'll tell you about how this is possible, especially through OMNIWave in this case. And then if you are in that space where you want to bridge that gap between conventional care and wellness and longevity, again, shockwave is one of the tools that you can use, and it's one of the easiest tools that can bridge that gap. And we'll tell you more about that too. So ultimately, what we're here to tell you is that shockwave is the solution and is the answer to all of those questions. But again, we're not taking that for granted. We'll tell you more on how this works, the different types of shockwaves, and how Jason, as many others, have used it to really transform his practices, and lead them to being extremely successful. So, Jason, do you want to tell us a little bit about what shockwave is, how it works, and why it's so effective?
Yes. So what we have is we have sound waves that are generated from a machine that are sent through the tissue. And when they enter the tissue, they do a multitude of things. The main thing that happens is these sound waves squeeze the tissue and cause inflammation. When we cause inflammation, what happens? Blood flow comes to the area, growth factor, stem cells, and they start to heal that microtrauma that we just created. The high energy acoustic waves, when they cause this microtrauma, it can be painful with the radials. It can be painful with some of the focus machines that are out there. But the upside is that you don't have to use injections. You don't have to use any surgeries to actually help your patients out. And so any office can have this machine, whether you're a primary care, whether you're chiropractor, PT. We have a lot of med spas that have these shockwave devices in there that can help the patient's natural healing response.
And so, Jason, when we think about regenerative therapy, right, we always associate that to what is more known like PRP, stem cells, which is what helps the body naturally heal. But then, as you said, like these are kind of invasive in the sense that it's injections, it takes time. It is also kind of costly for the patient. Well, with shockwave falls into that category of regenerative therapy. It's not as known, and yet the effects are very similar, if not practically the same, and is non-invasive, and the treatments last less than 10 minutes, which is amazing.
Correct. I think it's such a good intro to regenerative medicine. We have a lot of docs who will use the shockwave machines and inject with that, because what you want to do is you want to bring that blood flow into the area using the shockwave and then inject right after. And I mean, there's literature out there that shows that exponentially helps the patient.
Yeah, I think what you just mentioned, there's a ton of clinical studies out there talking about the effectiveness of shockwave, but then also combination therapy is huge. And if you have all the tools to do that, well, amazing. You want the first thing in your door is shockwave, and then you can apply all the rest as well. So that's really great. We spoke about focused radial. Do you want to tell a little bit more about like maybe the differences and why they're so different? There's these two big categories, right?
Yes. Now, the older and what I actually learned on and first started using was a radial shockwave. Now, the radials have their uses. They don't go as deep into the tissue, and they are a little bit more painful than the focused. Uses for them are, I like to use the radial shockwaves for, say, bruises, more superficial injuries, nothing that I'm going to be using to get deep into. Now, for men and women's sexual health, it can be used also, but again, you have to use numbing creams for the radials because they are very painful.
Yeah. The reason they're painful is because they kind of go superficial and like they're a pressure wave. So it's really on the skin, right? Well,
correct.
It's depending on the device again, and we'll talk more about that. They're able to go deeper, and the sound wave is so fast that it actually doesn't resonate on the skin per se.
Correct.
Yeah. So there's a lot of differences, and it's important to know the use cases of both because they both have their benefits. But then you want to identify which one is the correct one for your practice ultimately.
Correct. I kind of think about the radials are kind of like a grenade going off, and the focus are more like a heat-seeking missile. I can use higher intensity with the focus shock waves, and I can get deeper, and that's the biggest benefit. When the focus came out, that was huge for the shockwave industry.
You feel there's less treatments with a focused and more effective treatments than with a radial, or is it?
Yes, 100%. Right now, I have 3 shockwaves in my office. I have a radial. I have 2 focused. I don't use 2 out of the 3 anymore, but so I've played around with enough of them. I've probably have worked with 5 or 6, probably 3 or 4 radials, and probably about 3 focused. And I mean, it's night and day focus compared to radial. Again, radial is the older technology, and we're moving on even from focused shock waves. I feel like some of the machines that are out now are so much better than what has been around the last couple of years.
Yeah, for sure. So when we also speak about focused, now we did these big 2 categories of radial versus focused, but then there's also different types of focused, right? It's not just one focus. So here we have kind of the comparisons of all of them. Jason, do you want to kind of go through them a little bit and tell us more about that?
Yes. So you have the radial, the piezoelectric, electromagnetic, those, and especially the radial, of course, like we said, it's more superficial. The piezoelectric and the electromagnetic, they can go deeper. They can be focused. They are, again, a little bit older technology, but they're still very effective. Now we've moved on to electrohydraulic and the OMNIWave, and those are the next gen, the newer type of shockwaves that we have. And now it's getting fun because we're able to actually treat patients to the maximum, because we don't have to worry about putting them in pain like we did with the radials or the older focused machines.
Yeah, I think something that at least we get asked a lot on our side, and we're trying to explain, is when electrohydraulic is kind of that true shock wave. It's the spark in water and it goes directly to target. While piezoelectric or electromagnetic, they have other filters through which the shock has to go through.
Correct.
And the power of it is not as strong as what we can see in electrohydraulics in general.
And deadens it. It deadens the wave.
Exactly.
Yes.
And so what ideally, and we saw the graph earlier when we were comparing radial and focused, you have this shock, right? This wave that goes up. And the straighter the wave, the truer that shock wave is. But ultimately, it doesn't exist. There's no device out there that has a really straight wave 100%. That's non-existent. But what we try to accomplish, I would say, on the OMNIWave side is really getting as close as possible to that and allowing it to actually reach those depths that are not reachable with other devices.
100%.
Amazing. So Jason, tell us a bit about the 2 practices that you have and the use cases that you mostly attend. These are just some other use cases that can be treated with shockwave, but there's so many ultimately that the spectrum and range of cases is huge.
Yes. So I have 2 different businesses, practices. One is a chiropractic business where we do a lot of spinal decompression. And of course, we see a lot of patients for knee injuries, everything from TMJD to plantar fasciitis. And being a shockwave facility and loving shockwave, I've always had shockwave since I was in school. I was able to, with my basically pain clinic, I'm able to use shockwave for everything from low back pain to tendinopathies, etc. Now, on the other business, I have a men and women's sexual health business, and we primarily do GainsWave and FemiWave, GainsWave for her. And I'm able to use the OMNIWave, and I don't have to use any numbing gel. So that is the biggest thing that I'm able to now. I don't have any pain when I'm treating those sensitive areas. And so between the two businesses, my shock waves, like I said, I don't use the other two anymore. I only use the OMNIWave mainly because it's pain-free. So I'm able to help, with stress fractures, sexual wellness, a lot of tendinopathies, and a lot of acute and chronic inflammation that comes into my office every day. And then, like I said, on the men and women's sexual health side, I see a lot of men and women for ED and sexual dysfunction. So I see a lot of cases daily, weekly, that I can use my OMNIWave.
Yeah. And I think if I recall from the story and your background, you said you also treat a lot of athletes. I mean, that's a big category as well, because not only is it like pain related necessarily, but just like it can be used as a tool for recovery. And athletes are a big target for that, right?
Yeah. So I was a high school head football coach in my area. And so I still know a lot of the coaches, and everyone sends their athletes to me. I tell them the sooner I can see them, the faster I can get them. We don't want to get them into that chronic inflammation stage. We want to get them in and get them out. And I have dozens and dozens of stories of how I was able to help athletes, young athletes, even. We have senior Olympic Games athletes that come into our facility that get treated, and they specifically want shockwave. They know what it can do, and they know that it can take them from that 5, 6, 7, 8 pain and take them down to that 0, 1, 2 almost instantaneously.
Yeah. Amazing. That's really cool. I'm looking forward for you to share actually some of those stories now. And part of that is, Jason, I wanted you to tell us a little bit about your story per se. You told us about your background. You told us about the practices that you have. But then there's been that kind of aspect of you using so many different shockwaves and testing them out. And then finally, making your pick for OMNIWave and kind of leaving the others aside. But more than that, it's really answering those 4 questions that we asked at the beginning of this presentation. Is it like, how did it change your practice? How did it make it better? What was the ROI instantaneously? Or how did it actually grow your practice to become that hub for regenerative therapy? How do you combine these treatments? And just ultimately, what is the way that you use shockwave in your practice? And you already spoke a bit about it, but just a bit more in depth.
So when I was in school, when I was in clinic, of course, I used a shockwave, and they were radials. There was 2 different radial machines, and I used them sparingly here and there. It wasn't until I was injured myself, I hyperextended my knee, and I started using it. I was on crutches, used it a little bit too much. I didn't really understand it at the time, that I should have given myself more of a break in between the treatments. But in 2 weeks' time, I was running again. That kind of really sparked my interest. And I'm a techie type of guy. I always like to have the newest and best tech. So I just went all in on shockwave. I started, contacting manufacturers even when I was in school, and just setting up demos, going to conferences, sitting down, treating myself, treating other people, just trying to see what this technology really was about. When I graduated, I immediately, very first thing I did was I financed a focused shockwave machine. And, I didn't have any patients. Now, I was lucky enough to be in my town. I never left my town for school. So I was able to, basically start, and I had a small patient base. But the main thing that I was able to do to grow my business was give demos. So any patient that came in that had any type of pain, whether they were there for low back pain, neck pain, I would ask them, do you have anything else going on? And, oh, yes, my wrist, I have plantar fasciitis, I have tennis elbow. And I would treat them and give them a demo for free. Well, when they felt amazingly better after that one treatment, then I was able to, sign them up for a care package and bring them back in. So from day one, it set my practice up for, when it's scary coming into business. And I was able to start making money day one. And it was such a game changer because I didn't have the buildup like most businesses do. So I was able to go through and just keep building and building my patient base with Shockwave, pretty much, like I said, by giving demos. I'll give demos to every single person that comes in because it's not something people hear Shockwave. And first off, that's kind of, I don't want to be shocked. But it's one of those technologies that people don't really know about. So the more that I could put it out there, the more it came in return and came back to me. This past summer, the beginning of last summer, so almost a year ago, I was able to get an OMNIWave. And that was a game changer for me, mainly because all of the other Shockwave devices, they have to put you in pain to get you out of pain. As I spoke about before, this technology is painful. The shocks that are going through, can be painful, especially if I turn up the machine to a point where I feel that I need to get you the best treatment. And sometimes I can't do that when I have Mrs. Jones, who's 80 with a foot injury in my office, and I just can't put her in that much pain. So now with the OMNIWave, when I treat my patients, they don't feel anything. There's no pain at all whatsoever when we're treating with this machine. So it's just been such a game changer. I can turn it up to an 8, 9, 10, where I could never go above 3, 4, 5 before to treat Mrs. Jones' foot. So now I'm actually giving my patients really good treatments, and I'm actually healing them faster, which is just absolutely amazing to me. And now I can treat areas like TMJD, where it was almost too painful to treat with a focused or another focused or another radial. I can treat plantar fasciitis and they aren't squirming and breaking out into a sweat. So it's just, like I said, it's just been such a game changer with the OMNIWave that it is the first true device that is electrohydraulic and it is true Shockwave that doesn't have to put you in pain to get you out of pain.
I love that. It doesn't have to put you into pain to get you out of pain. But that makes sense. I think I would say, what is the success rate that you see with your patients coming in with different type of issues? Is it something that you see like an immediate success after like one treatment? And how long is that treatment normally for you? Everyone, we do have our protocols and everything, but then obviously it comes to the expert, in your case, Jason and other doctors out there, to assess the treatments. Like, what would that success rate look like for you? How many sessions typically do you do for certain pain or trigger points, so to say? And just let's go a little bit more in depth on the use cases and how you apply it to your practice.
Okay, so I'm going to start with acute first, because the acute cases, of course, are going to be a lot quicker than the chronic. So as I had said before, the quicker that I can see somebody after they've sprained an ankle or they felt some type of pain in their body, the quicker that I can get them out of pain. So that treatment plan might be 4 to 6 treatments, whereas a chronic can be anywhere from 12 to 15 patients. It really just all depends on how old the patient is and how long they've had the pain. The younger the patient and the more acute, the quicker healing, of course, because the body's going to heal quicker. I've been able to treat a lot of stress fractures. So we have an in-house x-ray, and we will x-ray and then treat over the area. And I was not able to treat over the area with traditional focused or definitely not radial. It was just way too painful. Now I can treat over the area. For example, I have a 19-year-old female who broke the medial part of her collarbone. It wasn't a full break. It was partial, just a tiny bit of crack in there. And we've treated her 5 times over about 2.5 weeks. And we just believe yesterday, it was Monday, we took another x-ray and it is healed. It speeds up osteoblast formation. So that is something that is just huge that I would not be able to do in any other way. Basically, what do? We immobilize the shoulder and just wait. So I was able to really speed this healing up for this 19-year-old girl who hasn't been able to work for the last couple of weeks. I see a lot of, I'm in, again, Ormond Beach, a lot of golfers down here. I see a lot of golfers elbow. We have LPGA, that is the LPGA International Golf Course right near us. So we have a lot of golfers in the area, and I'm able to treat that without injections, without having to have them have any type of surgery into that area. So I'm seeing more and more referrals from these pockets of tennis players, from these pockets of golfers, and they just keep referring more and more people to me. So I've gotten in with each of these type of pickleball organizations because everybody, if you're a golfer, you're a pickleball player, you want to play and you want to get out of pain as quick as possible. So I've been able to really heal these individuals quicker than traditional, of lasers and, other scrapings and, ice and rest and painkillers and injections. We don't need to. I can just use this. And it's just so nice being able to bring something into your practice where you can heal everything.
Mm-hmm. Yeah. I think I love that you shared some testimonials. We have here some on the presentation. These are actually not yours, but you have so many of yourselves. I think these were just also very powerful, and I wanted to share these for people to actually read through. But what you were saying, and I'm going a little business here with Jason, because that's part of the questions that we had, is you kind of focus on those pocket and niche markets and audiences. And then you saw that it started to become a referral system practically, because once you have a tool that is absolutely painless and it's an in and out kind of thing, which is also like just allows people to come in, do the treatment, see results practically immediately because they already feel better after the first treatment. And then obviously that creates a cycle around your business area, right?
Correct.
Yeah.
So I focused on golf, the golf population around my area, around the tennis population around my area, pickleball, CrossFit. We all know that CrossFit, every single one of those CrossFit athletes get injured quite frequently. Tennis, or I said tennis, pickleball, and then running clubs around the area, and some of the triathlete groups also that ride together. We have a large group of individuals who ride together, run together, swim together, and I've gotten in with them and supported their races, etc. Like I support all of the other sports, and that has just given me an end. They know that if they get injured, I want to see them immediately, and they know that they almost have a standing appointment. They can call me on their way, and we will get them in and get them treated so they can get out of pain and back to doing what they love.
Yeah, I love that. I think something else that you also mentioned, we're sharing some secrets here actually from a strategy perspective, but I think it's important for everyone to know how that works. And also part of what we do is help our doctors in the strategy and marketing and business tools. And one of those strategies is that demo strategy that Jason, you mentioned earlier. This is probably one of the only treatments that you can demo. around. And it's like, you can't be like, well, I'll give you a PRP injection. Come here, let's demo that, right? That wouldn't work, or stem cells even less. And any other treatment, it's kind of similar. And in this case, you're able to just bring in a patient that came in maybe for a PRP, but then you're like, hey, I also have a new tool in my office. And do you want to try it? It's going to stimulate and work and help even further. And you can do that in 2 seconds. And they see actually an immediate result. So that whole response cycle really helps the movement and acquisition of new patients.
It's amazing. And it's even better now using something that doesn't put them into pain. Because before I would give a demo and it would, for me to turn it up to where it's spicy for them, they would withdraw and question whether or not they wanted this free demo. Now I can treat the area. And again, I can talk about their kids and not hold their hand and say, breathe through it. You'll get through it. No pain, no gain. And it's comforting to myself and my staff that we don't have these people that we keep putting into pain and making sweat and to help them, get out of this pain that they're in.
Yeah. And one of the questions that we had again at the beginning was that return on investment. Tell me a little bit about how you saw that return on investment. Obviously, you invested in different types of devices. I'm sure you also have just different devices that are not necessarily shockwave, but was that a very fast return on investment for yourself? And obviously you're seeing the results, but how did that work for you?
So we have one of my niches inside of my chiro business is we have a knee clinic. And so I'm able to bring in via Facebook marketing, via Google, I'm able to bring in patients and I give them a free treatment right away. They come in for a free demo. Now, when they come in for the free demo, I'm able to, immediately get them out of some sort of pain. And that's helped me, again, sign up so many more patients to be able to not only afford a great machine like this, but to, afford a better lifestyle, basically. And now that you can also use this for men and women's sexual health, and you don't have to use numbing cream at all for the treatments. So this regenerative medicine in a box, shockwave, OMNIWave machine that we have is just, you're able to use it with so many problems in the human body that if you advertise right and you're able to spread the word within your own patient base. And that's the most important thing, is all the patients that you already have is giving them free demos, is letting them know what you have, and being able to, if you have a practice with patients already, you should be able to pay off the machine, that return on investment fairly quickly, just with your own patients without even advertising that you have this machine.
Yeah, I think that's huge. And so based on everything that we've talked about, do you think, is shockwave a must in your practice if that's the direction that you want to go into, like regenerative therapies and just in general in a practice that wants to be successful? Do you consider that practically a need rather than just a want?
I'm not sure what I would do without having a shockwave in my office. There's so many problems that come into my office that I'm able to treat with this. And even if you have a primary care office, even if you have, an office where you don't think that you would use this machine, and we have that all the time. I speak with docs all the time that, I don't know how I would use this. And well, your patients, every patient that comes into your office, whether they're coming in just for a checkup or they're coming in for, it doesn't matter, XYZ, they are going to have some type of other pain going on that you can treat. And like I said, by giving them that demo, that's going to help them. And you're going to be able to build a client base and even a referral base from them to help your primary business grow, even with this machine.
Yeah, I love that. That's really great. So Jason, I'm gonna kind of finish it off here, but I'll leave the space open for any questions that we might have. If not, I do have questions myself that we get a lot of times, and I'd love to put them out there. We wanted to keep this sweet and short. We again know everyone is very busy, and if there's more questions, you can always contact our experts. You have a QR code right here that you can scan immediately, but we'll also be reaching out with more information. We'll give you the contact of Jason as well, so you can ask more questions if there is any. But I'll give it a little bit of time and see if we do have a couple questions coming up, maybe in the chat, or if you want to raise your hand and we can put you on screen as well if you feel comfortable. I do see one raise of hand, two. I have Ricardo Tubbs. I'm gonna, I know he just dropped off. He just put that hand down. Let me see. I do have Sarah here. She's one of our people. Sarah, do you want to say something and you want to unmute yourself?
Hey, Jason, it's Sarah. Bryce, how are you?
Hey, Sarah.
Hey, I just wanted to chime in and ask, one of the things that we have a lot of providers that are asking about is, how long should I expect something like this to like break even on my in terms of an ROI? How many patients am I having to treat, and what are the different like price points that you're selling these at? Can you speak a little bit around the pricing and the ROI in terms of when they can expect to break even and kind of what their monthly ROI looks like?
Yes, definitely. I'm in a medium to small town here in Ormond Beach. I charge roughly for 10 treatments. It's right around $2,000. Now, I only do packages. So everything I do is package based. If it's an acute, I do roughly 8 treatments. If it's chronic, I do 20. Now, what I'm doing there is I just don't charge $2,000 for the 10 treatments. I give them deals, of course, and I do $1,700 for the 10 pack. I'm sorry, for 10 treatments, it should be close to $2,000, and I give it for $1,700. I'm seeing roughly, I'd say 7 to 8 patients for musculoskeletal a week. So, you're probably able to break even. Now, this is outside coming in. So if you already have a practice, you bring this into your practice, it's going to be a lot quicker because you already have that patient base to deal with. So right now, everyone in my practice has already been using this and they understand it. So I'm bringing outside people in, and I get about 6 or 7 patients a week that I sign up for this. And there's some treatments are $250. Just really depends on, of course, if you're in, Orlando, Dallas, a bigger city, you can charge more, of course. But it shouldn't take you more than a couple months to go ahead and get your return on investment. Now, if you're also doing men and women's sexual health, it really could be a lot quicker than that you could break even.
Are the packages different for men and women's sexual wellness?
Packages are different. So what we do we do 6 treatments and 12 treatments. 6 treatments are $3,000 and 12 treatments are $5,000. Mm-hmm. So it can very quickly, you can pay this machine off and start making positive revenue.
Amazing. Sarah, do you have any other questions that you'd like to ask?
Oh, sorry, I was on mute. The other question I was going to ask was, I get a lot of people that call in and want to know the difference between like OmniWave and some of the other focused shockwave devices out there. Can you speak a little bit about that in terms of the technology, the patient experience, and so forth?
Yes, it's basically three things. First thing is the pain. I mean, every other machine puts you in pain when you're being treated. So that is the absolute biggest thing for me. I can actually treat at the intensity that I need to treat at to heal the patient. So that's number one, is I don't have to put you in pain to get you out of pain. The second is its portability. It's a small unit compared to all the other units. I mean, this is it comes in a Pelican case. You can put on the Pelican case and wheel it around. It's very extremely portable. And the third, and what I think is almost one of the most important, is it's made in the United States. It's made in Tampa. So God forbid, you run into any problems with this. It's made in the United States, so OmniWave can service it fairly quickly.
Yeah.
Thank you.
Thank you, Sarah. Jason, another thing that you mentioned is those combination therapies and packages, right? Might it be the combination with PRP or anything like that? I just wanted to share also with our listeners how you try to put them together and how it works if they already have a practice where they do certain things. How do you combine these therapies together?
So combining PRP, what we like to do is a 12-pack of Shockwave, okay? And we will say, for example, a knee, we will treat the knee with the Shockwave for treatment 1, and we will inject also with PRP treatment 1. We will do, including that, we will do 6 more treatments. And then on the 7th treatment, we will treat again with the Omni and then inject again. So there'll be 2 injections. And we space these out, of course. So we're doing 2 injections and 12 treatments. So as a chiropractor, I'm not allowed to inject. So we have another practitioner who injects that we treat with. And so we will do the Shockwave first, and then they will get the injection afterwards. And that has every patient that has gone through that, we treat a lot of golfer and tennis elbows with PRP. And then we also do the P shot and the O shot for the men and women's sexual health. So, and we do the same type of treatment protocol with that. So we've seen the practitioner that we work with who does the injections, speaking with him and their staff, they just see such a positive, such positives from all the combining the treatments that they hadn't seen just by doing the injections.
Mm-hmm. Mm-hmm. No, I love that. I think there's so many range of treatments that you can put together, and the results are miraculous. We hear it all the time, and it's also wonderful to hear from you, and just in general. I think there's just so many ways to use it, and we've only seen the half of it. There's a lot of also on the, I think, aesthetic aspect too that we haven't really touched base, but there is research about that as well, and we're looking into diving deeper into that too.
Awesome.
Well, amazing. Jason, thank you so much for sharing your story, telling us more about the different types of shockwaves, what shockwave is, and really telling us also about your testimonials, sharing your business secrets a little bit with our listeners here. We do appreciate your time a lot. And also we appreciate everyone's time. Thank you for listening in. We hope this was very useful. And again, if you were not able to listen in and you're watching at this recording, feel free to connect with us. Let us know if you have any questions. We'll be happy to answer them by email or on a call. Again, you can scan the QR code, book a call directly with one of our experts, and we'll be very happy to answer all of them. And hopefully you'll have a shockwave device in your office and you'll see amazing results, and we'll be able to help you with that. And maybe that's going to be OMNIWave for you. Again, thank you so much.
Thank you.